Good day, all, and welcome to another series show on Benjamin TV. As you all know, I'm Vivian Oliver by name, and today with me is a health officer, Miss Lovett Okonkwo. Thank you very much, ma, for joining us on today's show. So, diving straight into what we have for today, just as I said, we have a health officer in the house, meaning basically we'll be dealing on everything concerning health. But before going into today's topic for the day, don't forget, for the good health of your engine, Jesco oil is the best. So without missing much of our time, let's go straight into what we have for the day. So today's topic for the day is going to be under hypertension. So make sure to sit and listen attentively to the very end. And don't forget to please hit the subscribe button and like for more of our videos. So, moving straight into what we have for today, which is about hypertension. Please, can you tell us what you know? What does hypertension really mean?
Okay. Hypertension, before I start to talk about hypertension, we ought to know what actually blood pressure is. Because literally, hypertension means an increase, abnormal increase in the blood pressure. So, now what is this blood pressure? Blood pressure is when there is a force that is exerted on the walls of the artery. You know, in the body we have great vessels, we have the arteries, the veins, the capillaries. All these things carry blood. Some carry to the heart, some carry away from the heart, while some supply nutrients to the body system. So now, when the force that is exerted at the walls of the arteries is high, as in the force by with the pressure at which the force is exerted on the blood vessels, that causes blood pressure. That is high blood pressure. That is where hypertension comes in.
Okay.
Yes.
So basically, this hypertension, it doesn't, just like you say, it doesn't just happen on its own. Like, what causes them? What leads to this?
That's good. Hypertension can be caused by so many factors. The major factors we can see genetics, which means that it's actually hereditary. It can run from generation. In the body, we have genes. Genes are what carries characteristics in the body system. I am fair or I am dark. It's from the genes, gotten from my mom or my dad or from my lineage. So these genes, when they are passed through, when someone or when the ancestors or your mom or your dad carries the gene of, as in they suffered from hypertension, it goes over to the kids. But it is usually high, on the high increase when there are no lifestyle modifications in this in the children. Yes, it increases the rate of this hypertension. So from in your own question, what actually causes hypertension? The major things we can see that can predispose on to hypertension is maybe kidney disease, one have kidney disease, diabetes mellitus, or maybe health complications. But there are risk factors. When I say risk factors, I mean things that can predispose one to have hypertension. Things, lifestyle things I can be doing that can make me to have hypertension. Number one is when I take too much alcohol. When one takes too much alcohol damages the arteries. It damages the vein. What alcohol does is that it projects a chemical, dangerous chemical, when taken in excess. So these dangerous chemicals makes clots to form in the blood vessels. When these clots form, what happens is that it stiffens the artery walls. And when the artery walls are stiffened and hardened, it will now lead to hypertension. Yes, the pressure at which the blood moves towards these vessels will now be increased. Okay, so that is it. Then we have so many things that can cause this. I've talked about genetics. I've talked about alcohol. I also drug abuse, caffeine, too much intake of caffeine. When we take energy drinks and all these things and other substances, they will lead to hypertension. Then other things we can, as I said, when one have kidney disease or disease like diabetes mellitus, like diabetes mellitus especially, it damages the artery walls, and when the artery walls are damaged, it hardens them. So when they harden them, we call that condition atherosclerosis. There is no free flow of blood to other part of the body, as in it gives the heart stress. Yes, the heart goes through much stress in order to pump blood. And in that way, the pressure at which the blood is being pumped goes high, leading to hypertension. So many factors. Pregnancy can still increase it because when a woman is pregnant, the kidney, the heart, as in there is much stress on them. Especially, for example, the kidney, the blood supply to the kidney is high.
Okay.
So the body system that runs in a normal way, there is a problem because it's giving more work to do.
Yes.
It will predispose one to hypertension if care is not taken. So that's why in antenatal, mothers are being taken care of. The hypertension are checked on a regular basis so as to ensure that there is no hypertension, because it's also an increase where this woman has have hypertension in her gene, yeah. So it will still lead to more, as in it predisposes her more to the risk of that hypertension. So when it is not taken care of, preeclampsia, which is hypertension in pregnancy, occurs, and it's one of the major reasons of mortality.
Okay.
Thank you.
Relating to the high blood pressure aspect, is it genetic?
Yes, high blood pressure is genetic in the sense that it runs in families.
Okay.
Yes, it's generational.
Okay.
But the implications isn't that serious unless the person that have this hypertension in his or her gene doesn't live fine. Maybe he doesn't make some lifestyle modifications. Okay. Let me give an instance. Someone that the mother or the father have this hypertension. Okay. The person ought to not smoke, not take much alcohol, not live a life free of stress, manage himself, engage in physical activity, which is also one of the major causes of this hypertension. So when one does that, the person is at the risk of having that hypertension. Yes, it's genetic because it runs in families.
Okay.
Thank you.
Okay. So relating to like the kind of food someone takes on a regular basis, does it predispose one to having this hypertension?
Yes, there are some foods that we take that can predispose us to hypertension. Example is high sodium intake. Sodium is a part of the salt that we take. It is the major part of salt that can cause hypertension. Yes, and when we take high sodium foods, most times some people will decrease the salt intake. Maybe they will stop putting salt. But the major food we eat, maybe in eateries and other places, these food contain major salts. Yes, the spices we used to cook in our houses, most of them contain much salt. The beverages we take, the sausage rolls we take as snacks, all these things contain high amount of salt. So when we keep consuming sodium, what sodium does to the body is that when we take much sodium, it leads to the retention of water. Sodium contains water. Yes, it makes the body to retain water. And kidney is one of the major organs in the body that will help us to push away water. Therefore, one of the major functions of kidney is to form urine. So when this water is being pushed off, the kidney helps us to excrete it. But when we take it in excess, water that is taking high sodium, water tends to retain in the body system. And when this water retains, it predisposes the blood vessels to retain water, causing hypertension. So we have to reduce the intake of sodium, or salt, and whatever way we can do that. We have to take more water. We have to go through activity, physical activity. Because some people, it will be very difficult to reduce the intake of salt. Some have salt shakers on their table, on the kitchen, where they cook. They remove that. Because the more you see it, the more you have the urge to add more. Then you test your food before adding. Because when you have added all the spices, you will feel, I have not added salt. You would add salt. So all these things will predispose to hypertension. So there are some fruits or food which we eat. There is a body known as dietary DASH, DASH. It means as in dietary association that tells us the food we have to eat for one that have hypertension. Yes, they told us to eat more of fruits and vegetables. In vegetables we have broccoli, we have spinach. All these vegetables they contain potassium, they contain magnesium. What potassium does is opposite to what sodium does. So what these fruits and vegetables does is to, as a sort of counter the effect of the high sodium in the body system. Yes, we take citrus fruit like oranges, lemon. Then we cook more with natural spices like garlic, ginger, cinnamon, and other ones. So we give more with those ones. These are the things that we can do to help ourselves. Yes, and reduce the intake of salt.
Okay. So for those local, it's not everybody that's actually educated. Like how does one know he or she has hypertension?
Yeah, how you know? Actually, hypertension has signs and symptoms, but hypertension is actually referred to as a silent killer. Why? Because one may have hypertension, one will not know. Because most times the symptoms come at the end stage. Yes, I'm supposed to mention the sort of the value of this high blood pressure.
Okay.
Normally, we have the average to be 120/80. When I mean 120, I mean the systolic blood pressure and the diastolic blood pressure.
Okay.
It's just something over something. So the systolic is when the heart beats. We call it systolic blood pressure. Then diastolic is that period of time the heart waits before it will beat again. As in just that short period, brief period that you have to, that one is the diastolic. So now, when one has hypertension, the systolic is just 120 or more than that. Then that means that the pressure of the person is high. Then when I talk about diastolic, when it is 80 or more than that. Yes, but normally the levels of hypertension in adults should just be, as in the level, the normal blood pressure level in the normal human should just be as in less than 120. Yes, it can be from 100 to 120. It varies in individuals. In children, 80 to 120. In adults, we have 95 to 120. Yes, so the same thing in that diastolic. The diastolic shouldn't exceed 80 or even reach 80. Sometimes 60 to 80 in adults. So when it exceeds, it's a problem. So the American Health Association gave us a table to note the levels of this hypertension. Yes, we call it, first of all, we have normal blood pressure level, which I said should be less than 120 as systolic and less than 80 as diastolic. Then the second one is the essential hypertension. That is just the primary hypertension. This primary hypertension is the one that doesn't have cause. As in, you're hypertensive, but you don't know the reason. You don't know how you got this hypertension. It's not essential hypertension. So on that table, it should be 120 to 129 for systolic. Yes, and diastolic should be 80 to 89. It's increased now, Yes. So the third stage is where hypertension comes in. We call it stage 1 hypertension. In that third stage, it should be from 130 to 139, while the diastolic should just be from 90 to 100, as in more than 90 or even greater than 90. Then in the stage 2, which is also another stage, in that stage is now up to 140. Is greater than 140. Yes, and then in the diastolic is now greater than 90. It's more than 100 now. Then in the other one, in the last stage, which is the hypertensive crisis, we call it hypertensive crisis. It is at this stage you see symptoms mostly. That's why I said that normally hypertension doesn't really come. Yes, it's a silent killer, because here you will now see the person is more than 180. Yes, the diastolic is more than 120. It's very high. And now this person tends to have headache, tend to have chills, tend to have nosebleeds. But it's rare, because some people their blood pressure might be very high. Yet they will not feel anything until it kills them instantly. The person might just lump. Yes. So it is actually advisable that we check our blood on a regular basis. And most times you don't just check and say okay, because some people have the habit of going to hospital, they just check, oh, my doctor said it's okay, fine. No, sometimes we recommend staying at home to check your blood pressure. Either you have the apparatus, and also before you check and say yes, I have hypertension, before a doctor diagnoses hypertension, the person should have checked for about 3 times. Using different, because you can check here, you can check here, using different hand cuffs, at least to know what is actually my baseline. Somebody might have high hypertension, as in high blood pressure, maybe let me say 140. 140 should be that the person have hypertension, but it's normal for the family. You understand? So that person doesn't really know. You say, okay, I have hypertension, I have hypertension. Maybe the person is not hypertensive, because it's just the normal blood pressure for his or her family. Yes. So that's why it's good for you to check and know what is our baseline. What actually is my family's, what's my hypertension rate or level. So that whenever you check and it has exceeded normal, you know, oh God, I have hypertension. Yes, so that's it.
Okay, relating to the apparatus you talked about, you said that it's more better for them to have it in their houses. The name, in case of people that want to get it.
Okay.
And where they can get it from.
The apparatus used for checking the blood pressure is sphygmomanometer. Yes, but you cannot just go out of your home and to buy a machine. It should be recommended by a physician. If you need a hypertension, because they themselves, they know the better ones.
Exactly.
You have so many fake. So the physician will recommend that you should go for this, and he will check to know that it's in proper working condition, so that you can now, because some of them are faulty. So that's why you still need to meet your doctor. And please remember that you have a hypertension apparatus at home doesn't remove the fact that you have to go to your physician. Yes, you have to go to him. He has to check. You staying at home to check is to detect any change in normal, then call his attention. Yes.
Okay, very good. Back to the high blood pressure aspect. Like, I wanted to know, does it affect the rate at which people age? Like, does it affect aging?
Yes, hypertension affects aging. How? Because when one ages, the heart, the kidney, the liver, the major organs in the body, they tend to go down in the activity. Whereas, I mean, if they work at if they work at a higher level before, they have to go down as the person ages, because these cells, these tissues are disintegrating. So as they disintegrate, these cells, the organs, the tissue also integrate. The heart, the kidney, the liver also disintegrate. So it makes them reduce in function. And because they reduce in function, the heart can no longer be able to pump at the normal rate. Yeah, so when the heart has an issue with pumping very well, the person tends to increase the person's blood pressure, especially when one is more than 65. But it is recommended that once one is more than 50, you have to be checking your blood pressure regularly. Yes, because you are actually also a victim. Yes.
Okay. Like pregnant women now, like does this high blood pressure affect them and the baby?
Yes, the pregnancy actually is also a factor in hypertension. How? Because when one is pregnant, some of the vessels in the body, like the kidney, the organs in the body, like the kidney, they tend to be over, they tend to the blood pressure or the blood flow to them is high, is increased. It can increase by 30 to 50%. When the heart itself increases, as in the rate at which the heart beats during pregnancy is also increases. So you know that the major thing, well, before we talk about blood pressure, we have to have at our fingertips the cardiovascular system. In cardiovascular system, we have the blood. We have the heart, and we have the blood vessels, which I said, when the heart pumps blood to these blood vessels, and the blood vessels, because the blood vessels, they are elastic. You understand? So anything that can make them to lose their elasticity will cause increase in the pressure of blood. So when a woman is pregnant and these as in the vessels, as in the heart tends to work more, as in there is more stress to the heart, this woman is predisposed to hypertension. You understand? Because it might affect the blood vessels, causing hardening or stiffening. Yes, that by narrowing the force of blood through it, leading to hypertension. So we pay a very good attention to them by checking them regularly at antenatal, as in whenever they come for antenatal visits, we check them so that to make sure that their there is no high blood pressure, or that the pressure of their blood is not increased, in order to help them.
Okay.
Yes.
Okay, good. You mentioned something about lifestyle. Like you said something about it helps to lower the rate at which someone is being predisposed to hypertension. So can you explain more on why you think lifestyle really helps?
Okay. In lifestyle is just the way someone lives. And you know, our value system have a role to play in hypertension. Someone that works in the office or works in an environment whereby you sit all day, that person, you tend to overload the heart. How? Because you are sitting one place, the heart tends to work more. What I'm trying to say is that activity, physical activity, exercise, moving around, it helps your heart's muscles and all the other organs in the body to work, as in to be energized, to work, to be active, to be more active. Yes. So physical activity is one of the major factors which I refer to whenever I talk about lifestyle. Yes. Because what will physical activity do? Physical activity will tend to produce some hormones in the body, and these hormones will help to regulate the blood pressure. In the kidney, there is something we call renin-angiotensin-aldosterone system. Renin is actually a hormone which helps to regulate the blood pressure, and these things are being released when there is physical activity. When there is no physical activity, it is a problem. Yes, some exercises like muscle strengthening exercises, meditation, exercises in general, they help to increase the release of these hormones, which help the body system to regulate blood pressure and be in proper condition. Then in lifestyle, I also won't forget to talk about smoking. Some people smoke. It's a lifestyle. When one smokes and it's a habit, it's a problem. So what does smoking have to do with alcohol, with hypertension? It's among the lifestyle modifications. In smoking, when you smoke contain tobacco, tobacco, they contain some dangerous chemicals. They contain formaldehyde, they contain nicotine, they contain tar, they contain other things, other dangerous chemicals. What does these chemicals do? The chemicals will go to those vessels through which our blood moves. It will harden them and stiffen them, thereby causing blood clots to clog up. When these blood clots clog up, it forms plaque. What that plaque will do, it will obstruct as in it brought a space through which blood will flow, thereby causing force, as in increasing the rate of force at which the blood moves. Yes, thereby leading to hypertension, because the vessel will no longer be elastic. Yes, little blood will be passing through the vessels. So when we have so many things to do in lifestyle, you have to check what you eat. When you go to eateries, check their food labels. Yes, in their food label, let me say this sausage. We know, overall as gala. Yes, if you look at the pack, you will see where sodium is contained on this on that pack. Yes, it shouldn't be more than 100 grams. Yes, it shouldn't be more than even 0.3 gram is much. Yes, so we have to check. So at least to make sure that you are not the one already prepared food, you are not the one that cooked those food, to know the salt content in that food. Another thing in this lifestyle is alcohol. A man is not supposed to take more than 2 drinks in a day. Alcohol have a major factor in causing hypertension too. Yes, so a man shouldn't take more than 2 drinks. A woman shouldn't take more than 1 in a day. Yes, but you see some people involving themselves in binge drinking. Binge drinking is when a man takes maybe 2 or 3 or 5 bottles in just 2 hours. In just 2 hours. Yeah. So these things will predispose to hypertension. Another thing I forgot to talk about is secondhand smoking. I am not smoking, but someone that is smoking is here smoking. So I'm there. Whatever that is coming from that smoke is also getting to me. Yes. So definitely I'm affected too. So but when people know, they tend to fight it more. Thank you.
Okay. Like we've heard the causes, factors, and everything. So, what do you think someone who realizes he or she has hypertension, like what could the person do?
Yeah. First of all, hypertension, as I said, it has so many risk factors. The food we eat, the taking of drinks, smoking, genetics. So check yourself. Know your family history. What is my family health history? Ask questions. If you discover your family had hypertension, live a moderate lifestyle. Everyone ought to live a moderate lifestyle. You mustn't find out before you check out yourself. I didn't say that overweight also has a hand in hypertension. When you eat much, obesity comes in, as in the body, the blood doesn't even see where to pass. There is fat, adipose tissue everywhere. Yes. So you manage how you eat. You quit smoking entirely. If it's formed as a habit, you can't stop it. Yes, but a doctor can help you if you seek for help. Yes. Then other things, you have to quit drinking. Yes, these things, the major thing the person has to do, first of all, you have to see your doctor, who will help and check you so that you have a baseline. Yes, then he will help you to modify your lifestyle. And then if there is a disease condition, like if person have kidney disease or renal diabetes mellitus,
okay.
or stroke even, that if that condition can be managed to some extent, then the hypertension, which is a risk factor, has to be managed too. Yes. So that's just try to live moderately. Yes, it will help you to cover hypertension and remove stress and other things.
But hypertension, could it be prevented?
Hypertension can be prevented. It can be prevented if you live moderately, if you stop taking substances, if you engage yourself in physical exercise, in meditation, mind blogging, if you engage yourselves as in you take more of fruits and vegetables.
Okay.
Yes, these things will help to prevent hypertension. Yes.
Okay, so does hypertension have a cure?
I would say yes.
Okay.
And I would say no.
Okay, so
Why? Hypertension actually doesn't have a cure because we said it's a silent killer.
Okay.
Yes. Why? Because whenever one has hypertension, the only thing that can be done is to manage hypertension. So managing it is just to make sure that those higher levels are being controlled. Yes, to say that I'm free of hypertension. It can only be possible if you have an underlying disease condition, like kidney disease. Yes, if you can be able to treat the kidney disease, hypertension will go. But it's mostly impossible, you know. Yes.
Okay. So having heard everything concerning this health condition called hypertension, you definitely agree with me that it isn't something anyone would crave for. So, in all essence, what I'm trying to say is we all out there should try to do the needful. Because as we all know, prevention is definitely better than cure. So try to, if you have hypertension, you've heard everything the medical officer with me here has said, try to apply most of the time she said, preventive factors and everything for the better health of you. And before I round things up, I would like to say a very big thank you to Miss Lovett for staying with us at the very end. And to our subscribing visitors there that stay with us to the very end, thank you very much. And for our newcomers, try to hit the subscribe button and like for more of our videos. And before I forget, it's not just the health of your body you're looking at, you also have to look at the health of your engine. Try the Jesco oil today, because it's one of the best oils in the world. And you also have to try our Jesco synthetic oil. It's very good. So, thank you all. Bye.
Ihe eji wee nye anyị ha taa bụ na ndị so na-enega anya testi mmanụ anya testi ya n'elu testi ya n'ala gba gburugburu wee fụ na ihe niile kwesịrị na ọ ga-adị na mmanụ eji akwụ ụgbọala dị na mmanụ a maka ozuzu oke wee sị na ọ ga-abụ ihe magburu onwe ya na ga-enye anyị satifiketi aka ndị ụwa wee mara na mmanụ Jesco oil bụ onyenwa bụ ọkaibe na Naịjirịa niile. Ijesi from Jesco, ịma na mmanụ niile bụ counterfeit. Ọ ya ka sọlụ ji wee bịa taa wee nenecha anya wee sị na ọ dị mma na ga-enye Jesco certificate a.